Antimicrobial resistance have become a significant threat to humanity. The development of antimicrobial agents have revolutionized the medical practices as well as the other sectors. The antimicrobial resistance has emerged as a significant threat to public health from the 21st century. And the common medications that were used against to treat infections like bacterial, fungal, viral, and parasites have now become resistant and threatens the effectiveness of prevention and treatment. The development of antimicrobial resistance has outstripped the development of the drugs, a silent pandemic. According to National Antimicrobial Resistance Surveillance Report of Bangladesh, which represents the data from 2017 to June 2023 of about 70,002 patients, shows that the antimicrobial resistance in Bangladesh, the current antibiotic pipeline contains 43 antibiotics and combinations with several therapeutic entities, out of which only 2 antibiotics are multi-drug resistant against the gram-negative bacteria. The overall clinical pipeline and the recently approved antibiotics are insufficient to tackle the emergence and spreading of antimicrobial resistance. By the recent trillion lives a year and 100 trillion USD are at risk. To the recent report, by 2050, 10 million lives a year and 100 trillion USD economic output are at risk if we do not find proactive solutions for drug-resistant infections now.
A type of virus that exclusively infect and multiples within the bacterial cell is known as bacteriophage. Since 2018, the researchers are into the bacteriophage combat the multiple drug resistance. Infections are going, reflecting on the globally expanding bacteriophage market. Phages are increasingly recognized for their ability to the antibiotic resistance bacteria, dispute biofilms, and penetrating intercellular pathogens to the conventional antibiotic. There are increasing the number of reports regarding the combination of phage and antibiotics for treating the people of multiple drug-resistant bacterial infections. Staphylococcus aureus, Enterobacteria species, Escherichia coli, and Klebsiella pneumonia exhibiting the high contributing to the significant share of hospital-acquired infections globally. Therapy as emerging as alternative treatment strategy. As antibiotic resistance continues to rise, phage therapy offers a promising alternative to conventional antibiotics. While most of the well-conducted studies on phage therapies have been carried out in animal models, advancing to human clinical trials requires a thorough understanding of these animal studies and insight into how they can be refined to make phage therapy a viable clinical option. Some potential challenges to the phage therapies are 1. Phage isolation and purification. Number 2. Mode of administration. Number 3. Stability and storage. Number 4. Regulatory and policy issues. And number 5. Cost and accessibility. We can address the challenges by number 1. Developing phage cocktail. Number 2. Optimizing phage delivery. Investigating different route of administration such as topical application can improve the efficacy of phage therapy. Number 3. Improving phage purification and stability. Number 4. Developing resistance breaking strategies. And number 5. Conducting clinical trials.